electrocardiography. As most of us already know, electrocardiography is a method we use to record the electrical activity of the heart. How this is done is surface electrodes are put on the chest or the limb, and from those electrodes, electrical signals are gotten. So how are these electrical signals gotten? They're gotten from 12 leads, 6 of which are chest leads and the other 6 are limb leads. Today we're going to be talking specifically about lead 2, but I'd like to let us know that each of these 12 leads give different perspectives of the heart. How do we construct an ECG trace? As we all know, the atrial muscles are smaller compared to the ventricular muscles, and as a result, the ventricles have more electrical changes associated with them. First, we're going to be talking about atrial contraction or atrial depolarization. Electrical signals come from the SA node into the right atrium and then the left atrium. On an ECG trace, this is seen as an upward deflection known as the P wave. We also have the QRS complex, which is associated with ventricular depolarization or ventricular contraction. We have a downward deflection known as the Q wave. The Q wave is followed by an upward deflection known as the R wave, and the R wave is followed by a downward deflection known as the S wave. Then we have ventricular repolarization. This is also known as ventricular relaxation. This is seen on an ECG trace as an upward deflection, and this is known as the T wave. How to read an ECG trace? An ECG trace runs for 20 millimeters per second. As you can see on the screen, we have large boxes, and in those large boxes, smaller boxes. Each large box contains 25 small boxes. We're going to be learning to read the ECG trace using the time scale and the amplitude scale. On the time scale, one large box is 0.2 seconds. This is equivalent to 200 milliseconds. If one large box is 0.2 seconds, that means 5 large boxes will be 1 second. One small box is 0.04 second, which is equivalent to 40 milliseconds. On the amplitude scale, one large box is 0.05 millivolts. If one large box is 0.05 millivolts, that means 2 large boxes will be 1 millivolt. Now we know how to read an ECG trace. The next big step is to know the normal durations for various ECG parameters. The P wave, for instance, in a normal individual should be less than 120 milliseconds, whereas the PR interval should range between 120 to 200 milliseconds. The QRS interval should be less than 120 milliseconds, whereas the QT interval should be less than or equal to 440 to 460 milliseconds. Now let's use the ECG parameters we just talked about in making diagnosis. The ECG trace on the screen has a P interval of 2 boxes, 2 small boxes. We know that one small box is 40 milliseconds. That means 2 small boxes is 80 milliseconds. We also know that for a normal person, the P interval should be less than 120 milliseconds. That means this individual has a normal P interval. Also, the QT interval of this individual is 9 small boxes, which will be 40 milliseconds times 9, which will be 360 milliseconds. We know that for a normal individual, the QT interval should be less than or equal to 440 to 460. That means this individual also has a normal QT interval. Long QT syndrome is one of the many heart defects that can be diagnosed using an ECG trace. Individuals with long QT syndrome have QT intervals that are greater than 460 milliseconds. The case on our screen is one of an individual whose QT interval is 2 large boxes and 3 small boxes. We know that 1 large box is 200 milliseconds. 1 small box is 40 milliseconds. Since this individual has a QT interval of 520 milliseconds, this individual can be said to have long QT syndrome.